William Haseltine joins me now. He's the Chair and CEO of Access Health International, an organisation dedicated to improving access to high-quality health worldwide. Thanks so much for joining us, William. How worried should people be about this new variant?
I don't think they should be particularly worried about the new variant. It's come from Israel, Denmark, United States now, and Switzerland, but it isn't widely spread. They should worry more about the prevalent strain, e.g. 5, which is the one that's causing the major disease at the present time.
So tell us more about that. What should people be most concerned about?
Well, they should be most concerned that COVID's back, that if you were high risk before, you're high risk again. If you had a terrible time during the last episode, you're likely to have not such a good time right now. The new variant is an unknown. It is very, very concerning to a few people. We'll have to keep our eyes on it. It could be the new Omicron, which means that nobody's protected. But we don't know that yet, so we have to wait.
So you're saying that those who've had vaccines, the boosters, even the fourth booster more recently, will likely not be covered for that, or we're still waiting to find out?
They will be covered.
Okay.
They will be mostly covered, not entirely. I have to say that there is an epidemic even among the well-vaccinated. That's just the way this virus is. It's like the flu. You get a vaccine and you can still be infected.
So when it comes to trying to decipher how people need to be immunised against these new variants, is this something that scientists are continuing to research and evaluate when it comes to new vaccines? And are we expecting a new vaccine on the horizon that will counteract these variants?
Well, certainly people are following these variants to understand what vaccines are needed. The new vaccine this fall will be an XBB, which accounts for most of the variants. This brand new variant is going to take a year or so to work out how serious it is. If it's all like Omicron, which it looks a lot like, we're in for some trouble. So,
you know, looking ahead, people masking up, that kind of thing, sure, in the more high-risk areas like hospitals, perhaps restaurants. But we're in a stage now where people are unwilling to wear masks, you know, for the majority of the population.
Right.
What kind of impact do you think that will have on the spread?
I think you're going to see a new epidemic that is spreading around. A number of people I know have already received the epidemic. They were mostly hospital workers. So certainly they're going to mask, and anybody who's got good sense is going to mask up before they put themselves in an unknown situation with unknown people.
And of course, institutions are already reacting to the rise of COVID. Some schools in Kentucky, Texas are likely to close or already have. How likely do you think are we to see more widespread school closures or even lockdowns across the country?
You know as well as I know that the schools issue is a very fraught one, and that parents are really at their wits' end for working and sending their kids to school. I believe most people will take the risk and send their kids to school. They may then have a risk of COVID, and some 15–20% of them may get long COVID. So there is a serious health concern ahead.
All right, William Haseltine, really appreciate your time. Chair and CEO of Access Health International.